A 42-year-old male presents to the hospital with fever, chills, and a generalized body aches. His vitals are heart rate 96, blood pressure 105/78, respiratory rate 18, and temperature of 100.4 or 38 degrees Celsius. He recently returned from New Orleans, where he went for a fishing trip in the Gulf of Mexico. He notes the trip was largely uneventful, but he does remember getting stuck in the right shin with a fishing hook that he removed with pliers. Blood cultures are completed and are growing a gram-negative rod. On physical exam, he is ill-appearing with several spider telangiectasias on his upper chest and palmar erythema. In addition, he has palpable hepatomegaly and mild asterixis. His right lower leg exhibits red, fluid-filled bullae overlying severe erythema and is warm to the touch. What is the treatment of choice? Is it A. acyclovir, B. ceftriaxone and doxycycline, C. prednisone and infliximab, or D. clindamycin? Pause here if you want some extra time, but we're going to go on and let's break this down into 5 quick points. 1. Let's understand the patient we're dealing with. On exam, he has spider telangiectasias, palmar erythema, and hepatomegaly. Right away, these keywords should clue us into the fact he has underlying liver disease. Specifically, we tend to see palmar erythema and spider telangiectasias in the setting of cirrhosis. 2. On presentation, he meets SIRS criteria and he has significant skin changes in the right lower leg. Right away, we should be thinking of infection. 3. He went on a fishing trip in New Orleans and developed a right leg wound from a fishing hook becoming caught. His cultures are growing a gram-negative rod. Putting these first 3 points together, whenever you have a patient with cirrhosis, concern for infection, after spending time in an area where they could be exposed to salt water, we need to think of Vibrio vulnificus as a causative bacteria, which is point 4. Vibrio vulnificus is a gram-negative rod that can cause severe infections. It's more prone to cause significant infections in those who are immunocompromised, such as those with cirrhosis, chronic hepatitis, hereditary hemochromatosis, diabetes mellitus, rheumatoid arthritis, and thalassemias. Infection can be caused by at-risk groups eating raw or undercooked seafood, or wound infection when swimming in saltwater marshes. Wound infections can rapidly progress from cellulitis to necrotizing fasciitis very quickly. In addition, diarrhea can be a symptom, particularly to those who consume contaminated raw or uncooked seafood. So how do we treat it? Antibiotic therapy is typically a 3rd-generation cephalosporin and a tetracycline. In addition, the wound should be investigated with imaging and physical examination to make sure there are no signs of necrotizing fasciitis, where there is a deep infection beyond the superficial skin layers. If necrotizing fasciitis is present, surgical debridement would likely be needed. To sum up, if you have an immunocompromised patient who presents with signs of infection after exposure to salt water or eating seafood, think Vibrio vulnificus and treat with a 3rd-generation cephalosporin as well as a tetracycline. Well, I hope you learned something, and if you did, please give a like, share, and subscribe. I'm Dr. K. Remember to keep learning, and I'll see you next time.